CDU. I've been here at the hospital for about 2 years, and just finishing up, as Debbie said, my bachelor degree. And so we had to do a teaching project on a topic that is of importance in nursing. So I chose communication because it's something we're always working on as nurses and can always improve. Ever feel like no one is listening with just something put in there as one thing? Go ahead. Thank you. Communication. So what is communication? Communication, by definition, from Encarta, is an exchange of information between people by means of speaking, writing, or using a common system of signs or behavior. And in nursing specifically, it's between patients, families, coworkers, physicians, and interdepartmentally. So basically, we're always talking to everybody. And when we don't do it well, things can fall apart quickly. Go ahead. When we have poor communication, it can cause increased patient stress, lapse in care, increases adverse effects, falls, anywhere from falls to decline in patient's condition. Poor patient outcomes, medication errors, and definitely decreased patient satisfaction. Communication is an invaluable asset. When you have patient-centered care, it's all about listening, attending to your patient, having empathy, information giving, and supporting. Busy floors, which we have a lot of here, with high dependency patients, which we also have a lot of, is the normal these days. So any time that you can devote to understanding and conveying your patient's needs is very invaluable. One definite and very important way of communicating is nurse to nurse. 2 ways we do that here is bedside reporting and huddle. The first, bedside reporting, is the way we like to do a proper and well-communicated handoff. It promotes patient safety and communication and their satisfaction. Bedside reports are done in the room with the patient, and it puts them in the center of their care and makes them feel informed and important, and that makes them for a much happier patient. It introduces the oncoming nurse to the patient and allows them to communicate their needs and questions. It takes about 2 or 3 minutes per patient, so it is a little bit longer process than when you're standing at the nurse's station just going over your patients one at a time. But it is much better communicated patient report. It ensures a better continuity of care. It's less loss of significant data and definitely better patient outcomes. It uses the SBAR method just like reporting at the nurse's station. The oncoming nurse is able to obtain important data to assist in prioritizing the care of not only for that patient, but in managing all of her patients and prioritizing each of them. If you have sensitive issues with that patient, you should all discuss those outside the room, psychological issues, anything with family issues. That is recommended to talk about outside the room. Next, team huddles, if that's okay. These are done generally on most floors in the morning shifts, 7 a.m., but they're done so that you can catch the morning and the nighttime shifts together. They're generally run by the nurse manager or sometimes the charge nurse. They allow for the nurses and the nursing management to communicate together for the entire floor. They increase your upfront communication, and they hope to decrease your frustration and confusion that come later in the shift. As we all know, as the afternoon goes on, stress increases, patient needs increases, and things get hectic. Huddles also strive to allow for open communication and collaborative decision-making among the entire team. Evidence also shows that huddles can improve your patient safety because they can allow for time for the team to talk about specific patients who are at higher risk for falls, risk for decline, highly medicated patients, just patients that the team as a whole need to help work together to take care of. Next is nurse to MD communication. This can be a frustrating experience for both the nurse and the doctors. Dysfunctional communication between these 2 people is responsible for medication errors, adverse patient effects, and poor patient outcomes, and definitely provider stress. Evidence shows that nurses who fear doctors or being belittled by the doctors are less likely to share concerns with patients with the doctors, which puts patients at risk. So it's important to be familiar with your doctors enough that you feel comfortable to approach them about your patients. When you do need to talk to a doctor about your patient, I've spoken with the doctors, and these are the things that they feel will help them better communicate with you about their patients. If you would first look at and assess your patient, know what their most recent vitals and labs and meds are. These all sound like simple things, but many times a nurse runs to the phone and says, oh, I need to tell them this, and we don't have the whole picture. So if we can just take an extra minute or two and grab the whole picture, it really helps. Know their admitting diagnosis. Sometimes in a rush to say, oh, this is going on with them, we don't know their diagnosis. And so if you just look at a lab value and it looks out of whack to you, but you know their diagnosis, sometimes that's normal for them. Identify yourself, your patient, and put your phone extension in your text. We use texting here to notify doctors, and many times they're down in CDU seeing patients and they're getting texts from around the hospital and they don't know where they came from. So they spend an extra 5-10 minutes looking for nurses. Briefly tell them the problem, when it happened, and the severity of it, so they can prioritize who to call back first. And lastly, treat your physicians with respect. Lastly is your patient. It's the final piece of the puzzle, but it's actually the most important piece of the puzzle. Learn to listen. Do you update your skills as a healthcare professional about listening, or do you learn from experience? It's an important question to ask yourself. Sometimes not all of us have the best communication skills, and it is something we actually need to learn. Just like all of our other skills, some of us don't have the best, and we need to ask ourselves that question and figure out who we need to learn from or how we need to learn it. And do you know how to recognize verbal and nonverbal communications from your patients? 90% of what they tell us isn't verbal at all. So we need to be sure we're looking at our patients and listen to what they're telling us in other ways. Sometimes also we get caught up in what I have called the T's, which is technology and task. Right now we depend so much on technology and high-level skills that it's easy to forget the fundamentals of care and communication should be the heart of everything we do. We are so busy computerized charting, computerized this, technology that, and learning and doing and trying to keep up, that it's really easy to get hung up in that and forget that your patient's laying in the bed while you're on the computer. The other T is task. We have pressures to collect data for quality and outcomes. We have pressures for HCAHPS. We have pressures for core measures. Sometimes we're so busy, again, looking at the computer for all of those things that we're not taking time to look at our patient. So don't get caught up in the T's. What are the solutions for this? Treat your patient with courtesy and respect. Establish a relationship with your patient, a relationship of trust. Listen carefully to your patient. Explain things in a way they can understand. Remember that your patient doesn't think on the same level you think, and put things in words that they will understand. And most importantly, assess your patient. Questions to ask yourself. Do you know what your own nursing communication challenges are? Who they are, what they are, when, why, and how? Is it doctors? Is it other nurses? Is it your own boundaries? Find out what they are and look for ways to improve them. And what can you learn from the nurses around you? Who communicates effectively that you see that you work with? Can you ask for tips, or can you watch how they do it? Can you go find other places to learn? So ask yourself those questions. Mostly establish relationships, be fully present, and just encourage dialogue with your patients, with your other team members. And lastly, the thing to remember is that you are always communicating with your words, with your actions, and with your attitude. So ask yourself if you're sending a consistent message, and if you are sending the message that you intend to deliver. Your patient knows, and your people around you know. So make sure that you're putting out the message that you would like people to receive. And that's all. Thanks for your time. I hope I got some on it.